Hello, everyone. Welcome. Welcome. So, we'll wait for everyone to come in because we want this live to be very interactive. So go ahead, share and like this video. So we're live on YouTube, LinkedIn, Facebook, and on Instagram. Okay. Hello, it's 6:30 p.m. I think. Let's go ahead and start. Um, Hello, everyone. My name is Letty. I'm a board certified psychiatric mental health nurse practitioner and one of the faculty for past review. So today, welcome. I would like to welcome everyone for our PMHNP Would You Pass? Lock It In Live. So this is a free review. We're going to go through 10 questions, but today it's going to be different. What we're going to do is we're going to have a test taking strategy, and then we're going to have a practice question, which is related to that. I usually do this with Dr. Morante, and he will be joining us lately. Hi, Jan. Welcome. Mabuhay. Welcome back. I hope you're enjoying our free live sessions to prepare you for the PMHNP board exam. So this is for ANCC and also your ANP. So today is going to be different. We're going to do test taking strategies. You're not going to know everything on the board exam, but if you have mastered test taking strategy, the chances of answering the right answer, choosing the right answer will be much higher. So, one thing that I want everyone to understand that the PMHNP board exam is not just testing your knowledge, it's testing how you think as a psychiatric nurse practitioner. Hello, Deepika. Welcome. Welcome from California. Hi, Cruz Yuri from Iowa. So, okay. So, like again, whenever we're answering questions, think like a nurse practitioner, not like a registered nurse. Okay. So many people fail because they don't know the content, but because they answer too quickly or overthink the question. So today, I'm going to teach you how the exam writers think. So once you understand their pattern, your scores will immediately improve. I have taken so many board exams, and my motto in life, I failed relationships but never exams. So I probably mastered the test taking strategies. Sometimes I still pass, like exams that I don't even know about because of my test taking strategy. And I would like to share that with you guys. Okay. So you only take the PMHNP board exam only once. Okay. So we'll wait for more people to join. And okay, how about this? For those who are already here that have joined us earlier, can you drop on the comments? Like so far, what have you learned while you're joining our free live sessions? Go ahead and put it on the comment box. And also, please join us on Saturday. We're gonna have a 6-hour live review session, last minute prep, especially if you're taking the board exam soon. We do recommend, love it. Yes, Yudi, test it. Yes, test taking strategies. You really have to equip yourself with test taking strategies. As RNs, we do a lot of like review sessions. I mean, not review sessions, but we do a lot of education. Yes, thank you, Deepika. Thank you so much. We think it through. Like we find strategies, we find like ways to actually help you remember things. You're not gonna remember everything, right? So having like mnemonics, remembering the pearls, focusing on what's really important, your emergency symptoms, what to look out for. No, the event on Saturday is going to be a live session, but we're also coming up with on demand, like but on your own pace. You can review those things. Yeah, I mean you can review the videos. And then, yes, so the Lock It in Live, the Would You Pass session on the 27th, Saturday, 8 a.m. to 2 p.m. Pacific Standard Time. Yes, thank you, Janet, Mnemonic, and Pearls. Yes, really focus on those things because you're not gonna, again, there's like thousands of resources, thousands of pages you have to read, right? Like psychotherapy alone. Oh, thank you. Exactly, exactly. Like focusing, identifying your keywords, thinking like a nurse practitioner. So there is a QR code on the screen right now. Yes, I am a professor too, and that's how I also teach my students. It's easy to remember, right? There are also like mnemonics that were taught to me when I was in nursing school that until now I still remember. My favorite one is the what do you call this one? The cranial nerves. I remember that. Someone's gonna drop the link too. If you can't scan the QR code to enroll, we're gonna put it on the comment, on the comment box. All right. And then also for those who haven't purchased yet, you know, we've been getting a lot of great reviews with our study collection. So we have three, the PMHNP Mastery Field Clinical Concepts, and then the PMHNP Mastery Psychopharmacology. If you are, about to take your board exam, and at the same time, this is really helpful for new grads. If you're starting your practice, it's very, very helpful because it breaks it down like important things that you have to remember, what to monitor, how to educate your patients. And then Rise with Pass, when I was studying for the boards, this was the first book that Pass Review came out with. It's very, very helpful. You can enroll for the Saturday live review. It's on the chat box right now. And then for those who haven't ordered, you can scan the QR code, use the discount code PASS10 to avail the 10% discount. I'm so glad to see everyone back here again, like during our live sessions. Today is very important. It's test taking strategy. So we're gonna have the test taking strategy, and then we're gonna have a practice question. And we're gonna break down each of it, okay? All right. Are you guys ready? Okay, let's do this. Test taking number one. Read the entire question carefully. Don't rush. You have to read every word. So many test questions are designed to test your comprehension, not just your knowledge. Do you really understand this question? And then you have to pay close attention to keywords such as first, initial, priority, most appropriate, best, accept, and not. A lot of people, because of anxiety, couldn't see the word not. And it's actually looking for the answer, which is wrong, right? So you really have to read the question carefully. Um, Slow down. This is a computer exam. So sometimes you remember things, right? They're going to give you a pen and then a paper. What you can also do is you can also write the keywords, identify those keywords. And then because those single words that are in the question could change your answer. Okay, so for example, what is the first line treatment for? What is it asking? First line treatment. So what will be the initial treatment first? Say, for example, depression, if it's asking for what is the first line treatment, usually they give you what? Antidepressants, right? Initial is asking for your first action. What is the initial management? What do you have to do first? It's asking for action, not treatment. It's asking for action, right? And then another example, priority. What is the priority intervention? What is like the most important thing? Most appropriate. What is the most appropriate? Which of the following is not a feature of this symptom or a feature of this diagnosis? So it's asking for the wrong answer. And then all of the choices are proper management for depression. Which one, except for? So it's asking for exception. So if the question asks for the initial intervention, your answer would always be, it's almost never medication. Remember that. If it is asking for an intervention, your answer is almost never about medication right away. Assessment almost always comes before intervention. If there is an assessment, you have to start with an assessment, okay? All right, let's go ahead and practice with the first question. A patient with schizophrenia tells the PMHNP, the voices are telling me to hurt myself. What is the initial action by the PMHNP? What are your keywords? The patient has schizophrenia. The voices are telling me to hurt myself. But the question is asking exactly what? Initial action by the PMHNP. So your choices are letter A, initiate antipsychotic medication. Remember what I just said like a few seconds ago? B, obtain a suicide risk assessment. Letter C, contact the patient's family. Letter D, teach coping skills. Go ahead and type your answer on the comment box. Remember the words initial action when it is asking for what? When the questions ask for an initial action or intervention, the answer is almost never medication. So letter A is wrong. The answer will be letter B, obtain a suicide risk assessment. You have to get more information. Tell me more about it, right? Always remember your ADPI, your nursing process. Never forget that's the basic foundation of nursing management. Okay, for any condition, you have to assess, you have to diagnose, you have to plan, you have to intervene, and then what? You have to evaluate. You cannot intervene if you don't have an assessment. So, if you need more information, you have to collect those information. Okay? Good job. Everyone got the right answer. Okay? So, like, especially when the question talks about suicide, we talk about safety. So, we first determine how dangerous the situation is. Is it something that we have to report right away? Right? If there is like a risk to harm other people, is the patient at risk to themselves? So, you have to make sure what? So, if the question asks, with this question, right? If the question asks, what will be your priority? Then the answer will be different. Because for cases which is harm to at risk for harming themselves or other people, what will be your priority? Anybody put it on the comments. Just one word changes the answer, right? For this question, the question was, what is the initial action of the PMHNP? Initial, what is the first thing you have to do? You have to assess, right? But if the question says, what is the primary? Yes, safety. You have to ensure. If it's asking for priority intervention, then that will be your safety. You have to make sure the patient is safe. Okay? See, one question. You just change one word and it changes the answer. Good job, everyone. That's how you should be, you know, attacking the questions. All right? Okay, good job, everyone. Welcome, Tiffany. Welcome. Wow, who else I haven't seen? Dolores. Welcome back. Question, test taking strategy number 2. Do not read into the question. Do not assume. Do not add words. Do not add more information. Use only the information provided. Do not add assumption or extra details. One of the biggest mistakes of students is adding more information. Like, just answer the question given to you. You don't add, what if? Oh, what if this person has this? Like, no, just answer that question. Okay? Use the remember this, use only what's there, okay? Use only what's there. The answer is in the question most of the time. The answer is just right there. Do not read into it, do not add to it, and stick to what is just given to you. So, um, strategy tips, okay? Read the questions carefully, identify the keywords to guide the questions, focus only on what is asked, do not add more information, okay? Because it's going to distract you. And then you're going to think more, and then you're going to be more anxious, and you're going to start panicking, and then you don't know what the answer will be. That happens all the time. Some people are like, oh, I failed because I spent so much time just staring at the screen. And I would like, what were you thinking? It's like, oh, what if this? Oh, what if that? What if the patient has this? I'm like, no, you just have to answer the question. Focus on what's being asked. Eliminate clearly wrong answers, then choose the best one. So the common pitfalls: reading into the question, adding information which is not provided, relying on an outside knowledge instead of the question, and then changing the question in your mind. And then panic happens, and then you choose the wrong answer. Most of the time, the answer is just there on the questions, on the keywords, right? Don't assume, don't add, just answer. Okay, let's go ahead and practice one question. A 32-year-old patient states, I have been sad for 3 weeks after losing my job. What is the most likely diagnosis? So it's asking for a diagnosis, right? So you're gonna answer a diagnosis. So what are the keywords? Your patient's 32 years old and sad for 3 weeks after losing my job. So losing a job is what? It is a triggering event. Okay? So choices are letter A, major depressive disorder, letter B, adjustment disorder, letter C, bipolar disorder, letter D, persistent depressive disorder. Go ahead and type your answer on the comment box. So the patient said has been sad for 3 weeks after losing a job. Okay, you have a triggering event. So students would usually think right away, oh, is it disorder? Is it depression? So you have to ask yourself, did the question say loss of interest, sleep changes, appetite, guilt, suicidal thoughts? No. So don't invent symptoms. Just focus on what has been given to you. The patient said he lost his job for 3 weeks. He's been sad for 3 weeks after losing his job. So 3 weeks and after losing his job, which is a triggering event. So what is your answer? Of course, letter B, adjustment disorder. You can easily choose letter A. Very easy. If you don't read the question, if you don't read the situation right away. So remember, if there is a triggering event, it is adjustment disorder. So the question does not mention mania. It does not mention chronic symptoms or major depressive criteria. Avoid adding information that was never given. Great job, everyone. Again, remember this. Answer only what is written, not what you imagine. Okay? Good job. Good job, everyone. You're going to be good test takers, just like me, after this session. All right. And if you have friends who would like to join right now, please go ahead and, share these free live sessions for everyone. Let's go ahead and do test taking number 3. Read all the answer choices. Some people would look at the choices and then they saw letter A sounds like it's the best, it's the correct answer, and they would answer right away. No. Read the question, all of it, and then read all the answer choices. Review every option before selecting the best answer. There may be a better answer than the first one. NCLEX does that. We'll give you all the right answers, but you have to choose the best one. The PMHNP board exam does that too. Sometimes, remember in other previous sessions, if there are two choices that are opposing, so sometimes one word just changed the entire meaning of that choice. So you really have to read it through. So read all of the choices and you have to choose the best. Okay? Do not select the first answer that appears correct because a better answer may be listed down below. Okay? You have to evaluate them all one by one. Avoid traps. So early choices may be partially correct, but not the best answer. And then questions asked for the most appropriate, best, or most accurate answer. And then catch subtle difference, Remember, sometimes there's only one word. Until, most, except, not. Not is always like before. When I was like, a fresh nursing grad, I would always forget, or sometimes I miss the point, or if I'm panicking, I'm nervous, or I didn't get much sleep. Sometimes I can't, English is not my first language. So what happens is when I receive the information from English, I translate it into my language, right? My original language. And then after that, I'm going to answer in my language and then translate it back to English. So that's if English is not your first language, that happens. When you haven't slept the night before your exam, you don't think through. If you're not breathing while you're taking the exam, you what? You decrease your oxygen supply in your brain. So what happens? Sometimes you don't think clearly. And it's just like little thing. You just have to breathe. Some people like blacks out during the board exam because of what? They're not breathing. They're so nervous. So you also, one thing that you have to remember, you have to start working on your breathing exercises before the board exam while studying for the board exam. Have a time to like mentally prepare yourself. And while you're doing your board exam, while you're taking it, take deep breathing. If you need to stand up, go ahead and stand up or stretch your legs. If you need to use the restroom to catch a break, go use the restroom. But you have to remember, even if you go to the restroom, the timer continues. Okay? So let's try answering a question. A patient with panic disorder reports sudden episodes of chest pain, shortness of breath, and fear of dying. What's the most likely diagnosis? So it's asking for a diagnosis, okay? The patient has panic disorder, reports sudden episodes of chest pain, shortness of breath, and fear of dying. Is it A, panic disorder? Letter B, generalized anxiety disorder? Letter C, social anxiety disorder? Or D, illness anxiety disorder? Okay, what's the answer? Remember your keywords. This is a trap. So look at the keywords. Remember, sometimes the answer is on the question. See, everyone's getting it. Yes, the answer is letter A, panic disorder. It's there. So I intentionally made this kind of question so you think like me. The keyword's right there. A patient with panic disorder, right? Reports sudden episodes of chest pain, shortness of breath, and fear of dying. So the best answer for this is panic disorder. If you add more information, this could become like a social anxiety disorder. Say, for example, shortness of breath and fear of dying while, in front of an audience or while talking to other people. Okay? But then again, remember, do not assume, do not add more information. Just answer the question based on the information that has been provided to you. Good job, everyone. All right. Good job. Good job. Test taking. Hi, Nikki. Welcome. Welcome. Thank you for joining us today. All right. Test taking strategy number 4. Assessment before intervention. Remember your ADPI. Assessment, diagnosis, plan, intervene, and then evaluate. Okay, you cannot intervene if you don't have more information, right? You cannot intervene if you don't have a diagnosis. You cannot create a diagnosis if you don't have what? Your assessment. So stable patients generally require assessment before treatment, okay? Assess first and then you have to act. Stable, if the patients are stable, you have to focus your focus on having your assessments first before doing anything else. But if the patient is unstable, then sometimes you have to act right away. Okay, stable patients generally require assessment before treatment, so you always have to evaluate before you intervene. So, establishing your baseline. What are your baselines? Your vital signs. Know the patient's starting point. That's where your old cards come in, right? Um, Baseline vitals, the symptoms, it guides like safe decisions. When did it start? How often does it happen? You also have to identify the needs, find underlying problems that need to be addressed. Example, assessment may reveal causes not yet recognized, right? You have to give more information. Like, when did this exactly happen? Like, well, my boyfriend left me for another person. So that's a triggering event. Okay? Prioritize care. Focus on the most important issues first. Address urgent or high priority needs before any treatment, okay? Prevent harm. Discover risks that could worsen with treatment. So, allergies, interactions, or contraindications may exist, and then improve the outcomes. So, better assessment leads to better results. For example, appropriate treatment is more effective and safer. So this is the next question will be the most commonly tested concepts, okay? All right. Question number 4. A patient taking lithium complains of nausea and tremors. That's it. I've had one-liner questions in the board exam and I'm like, "Oh, that's it?" Right? Because we're used to like on NCLEX, they give you like so many situations, yada yada. They drop like a lot of hints. When I took my other certification, I would get questions like this, just one liner. Okay. A patient taking lithium complains of nausea and tremors. This is high yield. It's often tested at the board exam. Letter A, hold the medication immediately. Letter B, obtain serum lithium level. Letter C, start propranolol. Letter D, reduce the dose. This is a trick question. So think again. You have a chance to change your answer. Okay. This is commonly tested in the board exam. Is this patient stable? Is the patient stable? It only says tremors, right? For lithium, it doesn't say is it fine tremor? Is it coarse tremor? Remember those words? See, this is a very tricky question. So many students would think, are you going to stop the lithium? Some people would say it's decrease the dose, but those two are the wrong answers. What if the levels are therapeutic? You don't know yet, right? So what are you going to do? You have to obtain the lithium level first. But if the question says a patient taking lithium complains of nausea and coarse tremors, then you will have to stop the medication right away. But this one, it just says nausea and tremors. You need more information. Because if it's just like fine tremors, that's a common side effect. So you have to obtain a lithium level first. So, right? One liner. Very easy question, very easy to understand. But it's very tricky. Okay, so you really have to read through it. Assessment before intervention unless the patient is unstable. You got it? It's tricky, huh? And that does happen. Some board exams would structure format your questions like this. That's why we're doing it right now to like help you think like someone who's making the board who's formatting the board exam. Okay, question number 5. Priority questions require frameworks. They always have frameworks. So use structured frameworks to identify the most important priority. Your ABCs, your safety, your nursing process, your ADPI, your Maslow's hierarchy of needs, your Eric Erickson's stages of development, your Sigmund Freud, they all have frameworks. They have all structures. So use frameworks to prioritize your care. So priority questions need structure, not guesswork. So you have to use proven frameworks. So ABCs, you have to prioritize airway, breathing, and then circulation. Maslow's hierarchy of needs. If you're given a situation wherein either you prioritize physiologic needs than feeling of being loved, you of course you have to choose physiologic needs because that's more important according to Maslow's hierarchy of needs, right? Safety, identify the immediate changes, prevent harm or injury, ensure a safe environment, use fall, infection, and medication safety, then reassess and monitor. Then nursing process, always the nursing process. So assess, diagnose, plan, intervene, and then evaluate. That's the basic foundation of everything that we do in nursing. Your ADPI. Maslow's hierarchy of needs. So most important is the lowest level. It's the physiologic needs. Food, eat, rest, air, shelter, sleep. Sleep is very important, especially in psych. If you don't get enough sleep, what happens? Some people would go into like psychotic episodes because of that. Safety, security, stability, love and belongingness, relationships and connection, self-esteem, how you confidence, like how do you perceive yourself, right? And then self-actualization, you're achieving your full potential. But how can you achieve your full potential if you're hungry, right? How can you achieve your full potential if you're walking on the streets and doesn't have any place to stay safely? Okay, let's do question number 5. Which patient should the PMHNP see first? So it's asking when you see first, assess first, or intervene first. These are priority questions. So you have to use your frameworks. Letter a patient with depression who reports insomnia. B, a patient with panic disorder who is anxious. Letter C, a patient with schizophrenia who reports command hallucinations to kill himself. Letter D, a patient requesting medication refills. You better get this right because I just literally mentioned earlier. Hi, Lar Honda. Welcome. Hi, Bruce. Welcome. Thank you for joining us. Yes, the answer is letter C. So whenever you see priority first, who do you see first? Who do you have to assess first? Use a framework. Use your prioritization skills, your ABCs, your safety. Okay? For safety, you have to ask yourself, who's going to die first? Right? Who's going to hurt themselves? Who is unstable? So the safest patient can wait. Okay, let's go back to the choices. Let's break it down. Letter A, a patient with depression who reports insomnia. Yes, it's important we have to address sleep, but is she stable? Is there any risk? No. A patient with panic disorder who is anxious. Red flag, yes, she's anxious. But then again, is she stable? Is she doing something else? Is she planning to do something else? Is she planning to hurt herself? No, she's still considered stable. Letter C, a patient who has schizophrenia who reports command hallucinations to kill himself. That is a priority. Why? He's going to kill himself. Among all of these people, among all 4 of them, this one is at risk of harming themselves. So you have 2 priorities, this one. A patient requesting medication refills? No, that's the least. That's the least important among 4 of them. Okay, so the answer is letter C because of the risk for safety. Okay, I think we got more people joining us, and thank you guys for joining. If you haven't, go ahead, like, follow, subscribe us on all of our social media platforms. Shout out to Dr. Karen and Mega Unisex joining us from Instagram. Thank you guys for joining us, and I really hope you find like benefits in joining our live sessions. And this is free. Please go ahead and share this to all of your friends, your classmates who are taking the board exam, or even like new grad PMHNPs. Um, and we really appreciate, so we can continue doing this. We really need your support. The only way for us to continue doing our live review sessions is through your support, okay? Because we're also like using resources. So please go ahead, like, follow, subscribe. On June 27th, we're going to have a PMHNP 1 day last minute prep. It's going to be live. It's 6 hours and it's high yield. We're going to focus on important things, board pearls, what usually comes out of the board exam, and then your safety, how to ensure. We're going to teach you how to become a safe nurse practitioner, because that's what the board exam tests you about. For those who are joining us today, you can scan the QR code to enroll. Use code welcome10 for your 10% discount. Okay, it's last minute. It's going to be fast paced, but basically we're going to have a lot of like practice questions too. So practice questions, and it's going to be broken down to different domains. There are 5 domains for the board exam, and each domain has a weight. And we're going to talk more about it there. And then we also going to talk about how to prepare for the boards, tips and tricks, how I prepared for the board exam, because we're going to want to make sure that you walk in, you walk out exam ready. Okay. And then for those who haven't, you know, we have books that you can purchase. It's really, really helpful. And it's not just for students, but also for like new grads. Or if you just want to renew your learning, sometimes, we've been in practice for a long time, and then we kind of like develop our routine, but then again, sometimes we forget like basic foundations. So this will be a great review. So for those who haven't, you can purchase, and then you can scan the QR code. The link is also on the comment box. You can use the coupon code PASS10 to avail of your 10% discount. Okay. Question number test taking strategy number 6. Safety is usually the correct answer. In psych, safety is usually the correct answer. So when in doubt, choose the option that keeps the patient safe. So when in doubt, choose safety every time. This is psychiatry. Our main priority is to make sure that the patient is safe, right? The priority is always safety, safety first, and everything. So, say for example, there's so many questions. I mean, the choices are like close to each other, and everything is correct. And you're like, what am I gonna answer? Choose safety. Okay. Choose the choice that prevents harm, that addresses immediate threat, follows priority. Also, you have to follow your priority framework. Remember your ABCs, your ADPI. Legal and ethical responsibility, Tarasov, very, very high yield. Ensure patient safety is a cornerstone of responsibility. Foundations for all care, safety must come first before any other intervention. So when two answers both seem reasonable, choose the safest one. Okay, for example, let's do the question. A manic patient becomes increasingly agitated and begins threatening staff. Okay, your keywords: manic, agitated, and begins threatening staff. Okay. Letter A, encourage journaling. Is that the appropriate time to do that? Letter B, allow the patient to walk alone. Letter C, place the patient in a quiet, low stimulation environment. Letter D, discuss childhood experiences. Okay, let's break it down. Letter A, encourage journaling. Are you really gonna let this patient journal at this time? The patient is increasingly agitated. That patient might throw the journal to you if you do that. Letter B, allow the patient to walk alone. No, you're not. Because you don't know what he's going to do while he's walking alone, right? And letter D, discuss childhood experiences. Is this the best time? Do you really have to discuss childhood trauma? that patient might get agitated more, right? Because the childhood experience can be traumatic. It can be a triggering event for them. So what are you going to do? You have to make sure the patient is safe by placing the patient in a quiet, low stimulating environment. Because safest intervention comes first. So you have to make sure that the patient is safe. Other people are also safe. Good job. Test taking strategy number 7. Therapeutic communication wins. When you see therapeutic communication, open-ended questions. Choose responses that explores feelings. Tell me more about it. Tell me how you understand your symptom. Tell me more about what you're feeling right now, right? Let's talk about this belief. What does it mean in your culture? Okay? So you have to remember feelings first, solutions second. Because why? As psych nurse practitioners, for us to be an effective provider to our patients, we have to establish rapport. How do you do that? You have to build trust. Therapeutic communication builds trust, okay? You have to explore feelings to promote healing. Because therapeutic communication builds trust, it encourages openness. If the patient trusts you, they're gonna tell you more about sometimes secrets, things that they've never told anybody because they trust you. They feel that they're open, that they feel that they're safe because you established the kind of therapeutic relationship with your patient. It also guides care. You cannot care for a patient who keeps symptoms, who's not very honest about their triggering event, who is not honest about when exactly did it start, how did exactly it happen. You can't treat them properly if you don't have this information, right? Like the onset, the duration alone could change the entire diagnosis based on your DSM-5 TR criteria. Respects the patient. When you execute a therapeutic communication, it creates such environment where patients think that they can trust you with their care, that they can tell you about things and not face like some sort of like judgment or prejudices, right? So for example, you can tell patient like it sounds like this has been really hard for you. Or you can say, can you tell me more about you how you feel? Or tell me what you think would be best for you. Like what would right now what make you what would make you feel better? Sometimes I use this with my coworkers or people that I talk to. I've been like practicing as if I'm like talking to a patient. Like when they're venting about something, I'll be like, so what do you think would make you feel better? What worries you the most? Right? How is this situation affecting you? Never use the word I. I think this is what's going on, right? How do you feel about what's happening? So always remember your therapeutic communication. Whenever a patient tries to like tell you about an emotion, don't fix it. Just listen, because therapeutic communication can answer dozens of like board questions. You don't fix it, you listen to it, you respect it, and then you explore it more. So good responses usually begin with like, tell me more. What concerns you? How does that make you feel? Avoid doing yes or no questions. But there is a specific demographics or ages of our patients that answering yes or no questions will be better for them. Okay, so remember your stages of development too for your therapeutic communication. If you're dealing with adults, if you're dealing with like, geriatrics without any memory problems, open-ended questions work well for them. Okay, so let's practice test taking question number 7. A patient says, nobody cares if I live or die. This is very common. I've seen patients who are like that. And then do you answer letter A? You shouldn't feel that way. You're trying to fix someone. Letter B, everything will be okay. Is it? Letter C, tell me more about your feelings. Letter D, why do you think that? So let's break it down. Letter A, you shouldn't feel that way. You are dismissing your patient's feelings, right? You are invalidating your patient. You're shutting them down. Letter B, everything will be okay. Is it going to be okay? Is everything really going to be okay? That's false reassurance. That's definitely wrong. Letter D, why do you think that? If you see the word why, that's wrong. You're like questioning that. You're like, why do you really feel like that? Why do you think that? So the answer is letter C. Tell me more about those feelings. So choose the questions that explore a therapeutic response. Open ended questions, okay? Avoiding your yes or no questions. So you're collecting more information from the patient. Good job, everyone. Okay. Everyone feeling good? Everyone feeling okay? Okay. That's taking strategy number 8. Avoid non therapeutic responses. So choose responses that support and heal. Avoid non therapeutic responses. Like think about care. Your care, CARE. Connect, ask, reflect, and explore. Okay? This is one of the domains for the board exam. It's your psychotherapy. Choose responses that help and not harm. So, like I said earlier, avoid why questions. Why questions sound very accusatory and it shuts down communication. Why do you feel that way? Why do you think this person hate you so much? Right? It's very accusatory. False reassurance minimizes the feelings and can make patient feel unheard. I think don't worry about it. Everything will be okay. Everything will be fine. Because sometimes not everything is fine. And then things turn out bad. And then you said that, you'll be like, oh, that nurse practitioner told me everything's going to be okay. And then what happens? You lose a patient because they don't trust you anymore. Giving advice. Giving advice too soon can show judgment and take away the patient's sense of control. That's why we use open-ended question because we're going to give back some sense of control to the patient. Let them decide for themselves. But of course, you're going to use like leading questions so that they can arrive on their own conclusion, so they can arrive on their own decision. You don't make decisions for your patients. Okay? For example, saying like, you just need to try harder. Yeah. Maybe you should do more. Or maybe you should cook more so that your husband is happy. Or, you know, probably work it out. Maybe it's gonna change. Or giving advice like, oh, how about, homeschooling your kids? You don't give advice. All right? Changing the subject. If you're changing the subject, your patient's gonna feel not heard. Okay? It avoids the issue and sends the message that feelings don't matter, that you don't care about your patient's feelings. Let's say, for example, let's talk about something else. Like, how about, oh, I remember, how about let's talk about this? How about let's change the topic? You don't do that. Okay. Question number 8. A patient states, I'm afraid my cancer is coming back. How are you going to respond? Letter A, don't worry about that. Letter B, why are you worrying? Letter C, many people feel that way. Letter D, tell me more about your concerns. Yes, we can go through that later. Let's finish all of this and then we have time, we can go through that. What's the answer? Choose the one that elicits more information from your patient. What would be your answer? Is it A? Don't worry about that. Or B? Why are you worrying? B is wrong right away because of the word why. Letter C, many people feel that way. Or letter D, tell me more about your concerns. The answer is letter D. Yes. Choose responses that explores feelings and support healing, not just shutting down your patient, okay? All right. Good job, everyone. Test taking strategy number 9. Consider culture before labeling symptoms. Very high yield. There will be a lot of like cultural questions on the board exam. Okay, understand the whole person. You have to respect their culture. If you see words that are quote unquote, that is probably a cultural question. So, culture first before concluding. Culture first before even thinking that patient has psychotic symptoms. Maybe, the way you perceive it in culture is different, right? Culture shapes how people express symptoms and seek care. So you have to understand first, and then you can interpret and see what's going on. Symptoms may be expressed differently for every culture, right? So different cultures may describe pain, stress, or emotions in unique ways. So, for example, some may report heat in the body instead of pain, right? Some people would say like, "Oh, I feel cold all the time," but actually, they're feeling sad. Beliefs influence health choices. You have to remember that. Every culture has their own like tradition, culture, and belief. So they shape the views on illness and treatment and prevention. For example, some cultures prefer traditional or spiritual healing. So how are you going to do with it? Right? If this practice does not impede with the treatment, that's totally fine. Like if there's a question about a healing stick, are you going to remove it from the room? No, you're not. You're going to respect it. Leave that healing stick in the room because some culture believe on it. Avoid mislabeling behaviors. What may seem odd could be normal in their cultural context. For example, silence may show respect, not lack of engagement. Or in some culture, eye contact means being disrespectful. That's why your patient is not doing eye contact on you because not because they're lying, they're avoiding you, but because in their culture, having like an eye to eye contact means you're challenging that person. So there are culture who have beliefs like that. Build trust and better outcomes. So cultural respect builds trust, improve communication, and leads to better care. So, for example, patients are let's see. Patients are more likely to follow care when they're feeling respected, when they're feeling heard. And then provide person-centered care. So the center of your care should be your patient, right? Not other people. Yes, you can work with people like support persons, their family, but it has to be person centered. What may work with this patient may not work with other people. Cultural understanding helps you see the person, not just the condition. Okay? So you have to choose options and care that fits the patient's culture that is more effective and also like meaningful. Okay, let's do question number 9. An Asian patient states he suffers from wind cold illness. What are keywords? Asian, and then wind cold illness. Letter A, diagnose delusional disorder right away. Letter B, start an antipsychotic. Again, assessment before intervention. Letter C, ask the patient to explain the belief. Letter D, reassure him the illness is not real. Okay, a lot of people are answering letter C. Hi, Laura Honda. Welcome. Thank you for joining us. What is the answer? It's letter C. Ask the patient to explain the belief. Tell me more. What do you mean about wind cold illness? So you're going to elicit more information from them. Cultural beliefs should be assessed before making psychiatric diagnosis. Again, assess first before you diagnose. Welcome, Ruthna. Thank you for joining us. Okay, before we proceed to our last question, again on Saturday, we're going to have a live 6 hour last minute preparation for your board exam. Walk in, walk out, exam ready. So you're gonna scan the QR code. If, for those who are joining today, go ahead and use the code welcome10 to avail of your 10% discount. So it's going to be a high yield review. It's going to focus on preparation. We're gonna help you test in clarity, be confident, and mentally prepare for the board exam. It's going to be on Saturday, June 27th from 8 a.m. to 2 p.m. Pacific Standard Time. It's going to be me and Dr. Morente. Thank you, Ruthna. Thank you so much for joining. W- Yes. Well, good luck. And really hope these sessions like really help you. Join us on Saturday for your last minute prep. Okay, 100 questions every day. You got this. All right. So, test taking strategy number 10. Beware of absolute words. Words such as always, never, must are often incorrect. So, use the mnemonic ANUM. Avoid narrow, overly absolute must statements. Okay? They limit exceptions, questions your critical thinking. So, you have to think flexible. You do not think black and white. Do not think absolute. Okay? Always, because it implies something is true 100% of the time. No, it's not. Remember when I told you, probably like a few days ago, when I said, like, when I standard psychiatric times. That's funny, Deepika. um, yeah, because, not everything will be perfect. Psychiatry, there's no black and white in psychiatry. It's a trial and error. Not everyone responds to the same medication. So always check vital signs before any intervention. When there's a word always, it's probably wrong, all right? Too absolute, because exceptions exist. Never. It implies something is never appropriate. It's Pacific Standard Time, but I like that. Standard psychiatric times. That's funny. Um, Example, never leave a patient alone, right? Implies something is never appropriate. It's too absolute. Only implies that there's only one correct answer, right? Only sterile water should be used, right? Only um only yes or no questions should be enforced. And then the word must implies there is no choice or judgment. Hi, Wiry. Yes, there is. So we have a store. Someone's gonna put it the link on the comments. Yeah, you can purchase from there. There's is a bundle. I highly encourage the bundle, but the Psychofarm is really good too. So why absolute words are often wrong? They ignore exceptions. They don't allow clinical judgment. They don't allow flexibility. Okay? They're often used in distractors. Okay. Let's do the question. Which statement about antidepressants is correct? Okay. A. Antidepressants always improve symptom immediately. Letter B. Antidepressant never cause mania. Letter C. Antidepressants may increase suicidal thoughts in some adolescents. Letter D. Antidepressants must be discontinued after symptom improvement. The answer is yes, of course, letter C. All the rest of the choices have those like absolute words. So beware of absolute words. Never, must, always, only. Okay, good job, everyone. All right. So that's the end for today. Again, if you have time, go ahead and join us on Saturday. Purchase our books. It's really helpful. And subscribe, follow us to be updated for our next live review sessions. And then someone asked questions about the open-ended questions. So we use open-ended questions all the time. However, there are certain demographics that may need like some modifications. Say, for example, for young children like toddlers. Yes, the open-ended question. So there are certain situations like that you can't use open-ended questions for patients such as young children, toddlers, or preschoolers. Like, so sometimes these questions need to be answered like, yes or no, if you want to answer more questions, if you need to elicit more information from them, because they can't give you the entire story. One perfect example would be patients like with sexual abuse, like 4-year olds or 3-year olds. And then instead of asking them like, can you tell me more about what happened, no, you're going to ask yes or no questions. It's easier for them. Patients with cognitive impairment or advanced dementia, are elderly with dementia, Alzheimer's, or memory issues. And then also patients with developmental disabilities. You don't use open-ended questions. Patients experiencing acute psychosis or severe mania, right? Questions should be short, clear, and focused, especially when your patient starts like talking more. So you really have to like set boundaries. It has to be short, clear, and it has to be concise. Patients who are having an emergency, you don't use open-ended question. All right. Tell me where your pain is. Okay. Point to me where your pain is. You don't ask them like, especially in medical emergencies, if the patient is stable, of course, we're gonna do our full assessment, open-ended questions, where did it start? Can you tell me more about your pain? Can you tell me about this symptom? But if the patient is in severe pain, patient is in a medical emergency, your question, you have to prioritize rapid and focused questions. Close-ended, yes or no, in a scale of 1 to 10. How's your pain? Okay. Point to me where your pain is. All right. The If you're talking to a toddler, um, there was like a specific situation before, a 4-year-old history of sexual abuse, and then they did play therapy, and then to elicit more information about what happened. And so like they were pretending that they're playing doll, like, can that's a very cute doll, show me where were you touched, and then the kid would show it to them. Or like, did this patient did your perpetrator touch you here, yes or no? Those things, because they can't express, so they have limitations when it comes to like talking. And that's where you use you don't use your open-ended questions. So you either use your yes or no questions, or your closed-ended questions, or like, yes or no, right or wrong questions. Is that helpful? So preschool, toddlers, patients with severe cognitive impairment, patient who has dementia, patients having a medical emergency, patients having like psychotic episode or mania, severe pain, patients who have developmental disabilities or learning difficulties. Okay. Thank you guys for joining us today, and we'll see you soon or in the next section. Again, on Saturday, we're gonna have last minute prep. Please join us. And then if you haven't, go ahead and follow, like, subscribe, share this to everyone. We really need your support as a community for us to continue doing these free sessions. And thank you so much for your support. Thank you so much for joining us, and we'll see you soon. Have a good night. Salamat. Thank you.